Okay, welcome to Episode Genetics, the final installment of our series. During our series, we've talked about acute lymphoblastic leukemia, and we've covered things like potential causes or risk factors. We've talked about genetically what's happening in some of these cases, translocations, the Philadelphia chromosome. We've talked about pathways and what can happen when things go wrong along the pathway. And we've met a lot of cool people along the way. So, today I want to talk about therapy and a specific therapy called CAR T cell therapy. And to do that, I want to introduce you to other forms of therapy. When I went through my acute lymphoblastic leukemia treatment, I was given chemotherapy. Now, chemotherapy obviously uses chemicals to kill cancerous cells. Um, it not only kills cancerous cells, but the downside is it also kills healthy cells. It can't differentiate. So that's why cancer patients lose their hair and vomiting, nauseous stuff like that because it's disrupting and hurting the good parts as well. And so, other options, other forms of therapy are being hotly researched because while chemotherapy can be effective, its side effects are pretty rough. So, one of those is gene therapy. Now, gene therapy has a few goals. It can be done to replace dysfunctional genes. It could turn off a mutated gene. Would like mitigate a faulty gene's functioning, or it could even be used gene therapy used to make disease cells more recognizable to the immune system. So this is only available in clinical trials, and the process really depends on the specific disease. But in general, the patient would go get their blood drawn, and in the lab, that blood would be exposed to a virus or another form of vector that already has the genetic material incorporated into it. And once the two have been combined, you inject it back into the body. The body takes up the vectors, who incorporates the new genetic material. There are dangers to this, and it's by no means surefire at all. You can get an infection from the virus. You could cause a tumor. You could target the wrong cells. And you can see the viruses there on the bottom right. Immunotherapy is another one that's being researched. Its goal is to boost the immune system. So it wants to improve or change the body's immune system. But why would you do that? Can boost an immune system really help against things like acute lymphoblastic leukemia, against cancer? Well, the idea is that sometimes the immune system doesn't recognize cancer cells, or sometimes it does recognize the cancer cells, but its response isn't adequate enough. Or even sometimes cancer cells actively work against the immune system by hiding or turning off things. So if we can boost the immune system, then maybe we can use our body to fight against cancer. There's a ton of different types of immunotherapy, as shown in the bottom right here. For example, checkpoint inhibitors, they're in the green. What they do, monoclonal antibodies are used in this. And in stopping um, immune checkpoints are used as a way in a normal, healthy body to keep the immune system in check from attacking healthy cells. But sometimes cancer can activate these checkpoints as a way to hide from the immune system. So even though the immune system knows there's something there, they turn it off. So checkpoint inhibitors do just that. They stop the ability of cancer cells from turning off the immune system and increase the immune response. The PD-1, PD-L1 pathway is a common pathway in this form of treatment. So, to the subject at hand here, CAR T cell therapy is actually gene and immunotherapy together. And what this utilizes is something called a T cell, which I'm sure you've heard of, or B cells. Both are used in the immune system. B cells produce antibodies, while T cells, among other things, actually attack the infected cells. T cells are they come from stem cells in the bone marrow, and I actually noted that earlier along the acute lymphoblastic leukemia pathway. But yeah, as noted before, some cancers can hide. So the idea is to use T cells, our seek and destroy cell missiles, to if we can genetically modify them, maybe they can find cancer a little bit better. So first, how does this process work? The patient has to be referred. This is not a surefire thing by any means, and so I have to be referred for this therapy. And it's worth noting that the T cells, like every other cell in the body, is affected during treatment. So if the patient had been getting months of chemotherapy, then their immune system is knocked down and their T cells are not as vital as they would have been earlier. And so what needs to happen is a treatment pause. And this can be a tough decision for the doctors because sometimes pausing the treatment might be fatal for the patient, or in the end just not be worth it. So that needs to be taken into consideration. If the patient is a viable candidate, then they will continue on with apheresis, which is just taking whole blood out of the body and then selecting cells or components from the blood that you want, taking those out and putting the rest of the blood back in. From there, after the T cells have been selected, they're sent to the manufacturer. The manufacturer multiplies them, and then the T cells are activated. They're infected with a virus. And this virus introduces the CAR and the T cell therapy, the CAR, which stands for chimeric antigen receptor. That's a specific receptor so it can bind to cancer cells. So after the T cells have been genetically modified, after they've been amplified and multiplied and all that, they're shipped back. And before they can be injected into the patient has to go through lymphodepletion, which is a form of chemo. That's just used to knock down the immune system so that it won't actually attack the CAR T cell therapy or CAR T cells, because they don't look like anything that our body makes. From there, it's injected and then it fights cancer. So there's a couple different forms that have been approved, and yeah, we're hoping for promising results. This is Scott McIntyre. In 2015, he was given a few months to live. He had diffuse large B-cell lymphoma. They tried chemotherapy, stem cell transplant, clinical trials, target radiation. None of it put him into remission. And eventually the cancer spread to his lungs. So he sat down with his doctor, and the doctor said, we don't know how this will work, but we hope it will help us learn more about this disease and help patients in the future, referring to CAR T cell therapy. And not a very positive outlook there, but hoping that they can help. McIntyre said, quote, "When I heard that, the pressure just eased away. I said, I'm ready. Let's do it." So he went in, he got the procedure done. Afterwards, he had a fever, which was expected, but then he started to feel better. A few weeks after that, he got a call from his oncologist to review his bone marrow biopsy, and it was revealed that the cancer was gone. He was in remission. And as of, I believe it was December of 2021, he was still in remission. So 6 years after he got this. So overall, CAR T cell therapy's success rate is 30 to 40% for lasting remission. So not awesome, but hopefully we can continue to grow in that. Stories like this are really cool and really inspiring for why science does what it does. So thank you for watching. I hope that you learned a lot about acute lymphoblastic leukemia, and you can go away more knowledgeable for it. Okay, thanks.